Thank you, Emily. Since its arrival last March, COVID-19 has had a devastating impact on North Carolina. Nearly 5,900 North Carolinians have lost their lives and counting. More than 284,000 North Carolina workers have lost their jobs and counting. And thousands of small businesses have shut their doors and counting. As we speak, vaccines are being administered to healthcare professionals. Treatments have improved and hope is on the horizon. Good morning, everyone. I'm John Nelms, the Vice President of the North Carolina Economic Development Association, and I'm a member of the Duke Energy Economic Development Team. I'm pleased to welcome you to today's webinar and look forward to introducing you to our guest presenter in a moment. First, our annual sponsors make learning events like this possible. You'll see their names on the screen now. NCDA is grateful to them for their ongoing support for our mission round the clock and throughout the year. Thank you to these important companies and organizations for their support of North Carolina economic development. Today's webinar is being offered in partnership with the Economic Development Partnership of North Carolina. I'd like to now call on the CEO of EDP&C, Chris Chung, to join me in welcoming everyone to this webinar.
Good morning. Thank you very much, John. Hello, everyone. Christopher Chung with the EDP&C. We're really grateful for the opportunity to help NCEDA host this important webinar today for everyone. We're very lucky. EDP&C has had the opportunity to partner with the North Carolina Department of Health and Human Services on a couple aspects of the COVID-19 response over these past 9 months, both on our tourism side with the Count on Me North Carolina Safety Campaign, which hopefully many of you know about, as well as in more recent weeks through our existing industry team, trying to help businesses and employers all around the state understand what safety measures and precautions they can take to keep their customers and employees safe during this situation. Obviously, COVID-19 has been the dominant public health issue for 2020, but I think all of us can say that is a dominant economic development issue, whether that's because a lot of businesses are facing reduced demand, whether businesses are concerned about safety of their customers or the safety of their workers. We know that COVID-19 as a public health issue continues to keep this economy from firing on all cylinders, both because of the very real health risks that it presents, but also because many customers and people who make our economy work are also concerned about the risks that they may endeavor when they venture out into the workplace or to do business. And so I think every step that we can help ourselves make, but also our business community make, is going to help us get COVID-19 more under control and allow our economy as North Carolina to fire on all the cylinders, which is really the key to successful economic development for all of us, is an economy that's performing at its full potential. And the sooner we can get this thing under control, the sooner we're going to be there. Today, we're going to hear some very helpful guidance from the North Carolina Department of Health and Human Services on what economic development leaders, as well as business and industry leaders in their communities, can do to be part of the widespread solution for both North Carolina and for our country and the whole world as we all work towards recovery. Again, we're really grateful for the chance to help host this important conversation today. Thank you very much for all of you carving out time on this cold, rainy December day to join in for this important message. I'm going to turn things back over to John, who's going to introduce our panelists. Again, thanks for the chance to help support today's program.
Thank you, Chris. Today's presenter, Sam Gibbs, joined DHHS in 2017 as a Deputy Secretary for Technology and Operations. An 8th-generation North Carolinian, Sam has 3 decades of executive management experience with technology and healthcare companies in Silicon Valley. As health policy expert, Sam has appeared on national media outlets including CBS, NBC, ABC, Fox Business, Bloomberg, and the Wall Street Journal. He was previously executive director of an internet company that compares and ranks health insurance plans. Sam was also senior vice president of customer operations at eHealth Inc., where he led the development of state-based health insurance exchanges under the Affordable Care Act. I'd like to thank Sam and his colleagues at DHHS for reaching out to us about offering insight on this important topic for our economy. Sam, the floor is yours.
Very good. Thank you very much. I really appreciate being here today. It's really quite an honor and a privilege to be back in touch with the business community. As you can tell from my background, I'm a business person. I've spent the vast majority of my career in business, even though I grew up on a family farm down in Carteret County out in Beaufort, North Carolina. I got the urge to become an engineer and went and studied aerospace engineering at Arizona State and spent the early part of my career in that, and then really started a business. Founded a business, a couple partners and I, and successfully grew that business and sold that to a publicly traded company, and then had the really fortunate opportunity to work in the .com through the 2000s and recently, and to take that company public. And so my career has spanned the smallest of startups to a larger publicly traded company. And I wanted to come to North Carolina specifically after I'd worked with a bunch of states during the Affordable Care Act rollout of health insurance exchanges. And so I'm here on purpose. I want to try to bring an understanding to the state and to DHHS, and certainly the governor and Secretary Cohen are really open to the idea of us working together to solve this problem of COVID. It affects all of us in different ways, and I think one of the biggest challenges we have is just we're all feeling the effects of what public health officials and the governor's having to do to try to stop the spread. But for many of us, especially in rural areas like in Beaufort where I'm from, I might not see the day-to-day effects of it, other than, now the bars are closing at 10 and I have to wear a mask everywhere. And so I think it's important on all of us in the business community to really understand that, what we're trying to do in this next phase until the vaccine is fully put into our citizens, that it's going to be tough. We're going to have to do some things that, are going to just have to protect not only ourselves, but our fellow residents of North Carolina. So, I'm here today to talk to you a little bit about some of the things that we can do together. I'm looking forward to the end of the session where you can ask questions or provide feedback. I can tell you that every day within the Department of DHHS and the governor's office, we're doing everything we can to, keep the economy open and going, at the same time protect public health. It's a really fine line. And but our goal is to make sure that you have the resources, you have the information that you need to help keep your businesses going, to keep your employees safe. And so, as a preamble to that, I'll launch into to some of my slides. Hattie, if you could go to the next one. One of the things that we've done recently is start to show, kind of on a granular level, county by county, where are the largest areas of concentration for COVID outbreak in the state. We started this, of course, at the end of November. We had planned on updating it just periodically to give, counties and businesses a chance to react to your area. But, as we all know, in the past 3 weeks, we've seen a pretty big acceleration in not only the number of cases reported, but also the other metrics. And those of you who have followed Secretary Cohen and the governor on their press briefings, that any one metric is not something that we're looking at. We're looking at a broad spectrum of metrics, and the case counts are one thing, and they've gone up considerably. But we're also doing a lot more testing, which is another tool that the state can use and that we can all use to help know if someone has potentially been exposed. But this slide shows that roughly 80% of our counties are in a red or orange, which means that there's considerable community spread. If you have a business that is interacting with the public, then your employees and your customers are being exposed to the COVID virus. And so it's no secret about the tools that we have available now until the vaccine is fully implemented. It's really about wearing masks and social distancing and washing our hands with sanitizer or soap. So We've seen this spike just recently. We know that folks during Thanksgiving got together. We encourage people to not get together. I can say personally, for the first time in my life, me and my wife just celebrated Thanksgiving together. We didn't get together with our kids or extended family for the first time. I think the other thing that we have to make sure is that as leaders of the community, not only us at the state, but you as business leaders need to set examples. I mean, we need to, it's going to be tough. It's going to be hard. But, I was reminded during Veterans Day this year on my Facebook page, I put up a picture of my dad who was in the Navy during World War II. And when I think about some of the sacrifices that previous generations have made, including my own father, this is what we need to do now in the next few months as our part to make sure that we can keep as many people safe as possible in North Carolina. So as we work together and as we give you more information, we'll be updating this North Carolina heat map, if you will, from time to time. But if you operate a business within all counties of North Carolina, I mean, some counties are yellow, but the vast majority are red or orange. We need to take extra diligence to make sure that we do what we can to keep our customers safe, because at the end of the day, that's the lifeblood of a business. We don't want to have an outbreak in a particular store or location if we have a public facing business, but we also want to protect our employees. We're here on a teleconference today. This is my home office. I'm working remotely, and so we've had to make a lot of changes, but it's made a difference. And when you look at the numbers for North Carolina, relative to our neighboring states and other parts of the country, I mean, even though our numbers are high, we haven't had a huge spike, and it's because of all the work that we've been doing. And my job here today is to help work with you that, we're close to the finish line. I think I've heard Governor Cooper say we're on the 10-yard line. We've got a little bit further to go until the vaccine kicks in. So I want to make sure that everybody, I know we're tired. I know we want to get back to normal. And especially with, the holidays of, I think we're in Hanukkah now and we have Christmas and New Year's coming. We want to get together. We miss our friends and family, but this is a time where we need to keep the fight up and continue to be diligent so that, come spring and summer, we can start to look in the rearview mirror of COVID. So let's move on to the next slide. So let's talk a little bit more about, what we can do individually as business owners. I think the next slide, Hattie. Oh, there we are. Okay, great. Nope, back. You got it. 3 steps. So one of the things that I think is important is that, we all know, kind of the things that we've talked a lot about, which are, get behind the mask, the 3 W's. The state has done a really good job of trying to simplify that message in multiple languages. But it's just about wearing the mask. And so what we can do as business owners is make sure that, we prominently display posters. If you are on social media, DHHS has done a lot of social media advertising in a lot of different ways. We're all individuals. We're all people. I'm in my 60s. I react to things differently than my kids do in younger generations. And so, each of us have our own biases about what we think about these particular tools. Certainly politics has played in it through the presidential election, but, that's all behind us now. And, really we have a chance here in the next 2 or 3 months if we do a really good job and we keep our numbers, where they are. The governor and the secretary won't be compelled to take any additional actions. I mean, nobody wants to go back to the beginning of the crisis when we had, a shutdown and a stay-at-home order. No one wants to do that. Our numbers are right on the edge of that. So I'm just encouraging all of you to double down on your efforts of, informing your employees, informing your customers. As I mentioned, I'm from Beaufort and I spend a fair amount of time down there. My local Ace hardware store was one of the first ones to put somebody at the front door to make sure and have masks and to make sure that everybody went into their store that they had masks. I mean, it's little things like that that you can do, you know, to make sure. I mean, you know, a lot of folks, you may or may not want to wear masks, but if you can help enforce it in your store, it's just let them know that it's okay, it's normal. And so I was very encouraged by just one act by one local store. It makes a big difference. The other thing is, well, let's stay on this for just a second, Hattie, is, and I think we have another slide on it, but we've also launched some technology in the past few months that allows an individual to, on their smartphone, to have an app here. And it's a totally anonymous app that was developed by Apple and Google, and the state vetted it. And it basically uses Bluetooth technology, which is like a broadcast. It has no location information. It doesn't keep any personal information. I'll go into more details, but you know, there's another tool that you can use to know that if you've been exposed, if you get a test, you can key that in and it'll let other folks know that if you've been in contact with, to get testing and to take the proper precautions. Let's go ahead and move to the next slide, Hattie. So here's some tips on just 3 steps that you can take to slow the spread. The first one is, as I've been speaking about, is just to share the recommendations of how to stay safe through the holidays with your employees. I know personally, I mentioned that for the first time I didn't get together with my family for Thanksgiving, and we're also not going to do that for Christmas this year as well. I have 3 kids. One's in California, one's in Indiana, and another one's in Virginia. And what we've decided to do is just to do something fun. Is that we, through Airbnb, have signed up for a cooking class. So on Christmas afternoon, we're all going to get on Zoom. We're all going to share something together. So I think, you know, encourage your employees to, as to the extent possible, to try not to get together for the holidays, as hard as that's going to be. You know, we know that we saw the spike after Thanksgiving because folks got together. But you know, if we can avoid that for the Christmas and New Year's holidays and the end of Hanukkah here, you know, it'll give us a chance to maintain the levels that we're at now, so that we won't be compelled to do any further actions as far as restricting people. So it's very important. I know everyone's not going to be compliant, and I know there's a lot of emotion around this issue, but I think as business leaders, you know, again, if we can set the example, you know, sharing, you know, just how to be safe, you know, DHHS and their communications team, along with Walker and our policy teams, we put a lot of information out on our website of other kinds of things that folks can do over the holidays. If folks have to get together, make sure you do testing. So I encourage you to broadcast the information so that people can go to our website, and we link to the CDC. We're giving you the latest information that's fact-based on, you know, how best to protect you and your family. So, and of course, we recognize that when we look at, unfortunately, the number of deaths we've had in North Carolina, the folks that have been affected by this the most have been high-risk individuals, and then also people in historically marginalized populations such as African American, Hispanics. And so it's especially important as you interact with those employees or those customers in your business that you let them know the importance of the 3 W's and the other precautions. And so I encourage you to continue to do that. If there's any additional information that you need, or you'd like access to some of the collateral materials we have, they're on our website. Please take advantage of them. Use the graphics, use the information to post on social media, you know, whatever you need to do to help get the message out. We definitely encourage you to do that. You know, in addition, you know, we have a lot of information on, you know, how to celebrate the holidays successfully, you know, flyers, social media posts, etc., that I mentioned. And then there's also some additional resources, and we have some links down in the bottom bullet here, which, you know, go specifically and some guidance on what we're recommending for businesses and details. It's really important information on how to protect your customers, your employees, and the community. We have FAQs. We have, you know, on the phase 3 guidance. So I encourage you to go and take a look at that. And you know, if you're a small business and you don't have an HR department, you know, whoever is who is responsible for that, you know, make sure they go. Your HR departments. If you know, I happen to run HR at DHHS. We've done a lot of work to inform our employees of the right things to do. We've sponsored seminars, and we've done actually some training videos on how to maintain safety, how to clean your offices properly if you do have a COVID exposure. So we're willing to share that information. So if you'd like to, you can reach out to us, and we'll share with you. Again, we make sure that our guidance on just cleaning your facilities after exposure is up with the latest CDC guidance. So those are all things that we encourage you to do to, you know, during this, again, I guess the next couple of months are going to be very important to us. So there's plenty of information out there. It's just, let's just stay with it, you know, through the holiday season. Hattie, we can go to the next one. Thank you. Really, the tools we have now, as the vaccine is being administered, are just the basics. And you hear us talk about this a lot. It's the 3 W's. You know, wear a mask, wash your hands, social distance. I'm pretty pleased that I've gone through the state. You know, I have a chance to move from the coast to the mountains, and certainly in Raleigh, and there are a lot of you that are doing a great job. I mean, you know, as I mentioned, the one example down on the coast, but you know, other businesses are doing great jobs, and I think that example will be not only for your business and your employees and your customers, but for just other residents of North Carolina as well. And you know, it becomes personal to a lot of folks, since so many folks in North Carolina who have had the virus or know someone. Sadly for me, 2 of my classmates from my high school have succumbed to the virus. They're victims of it. So when you know somebody who has lost their life to this, it kind of puts a fine point on it. I hope that on this call, I'm the only one that has to experience that. But that's why I'm so passionate about us following these rules. In addition, I'll share with you that my daughter was one of the early victims of COVID. I mean, victims. She got the disease. Now she was 29 years old, but she ended up with double pneumonia and was in the hospital for 4 days. So even young people can be affected by this. And so I just want to make sure that we do all we can to make sure that people understand, you know, that for the vast majority of people that get this disease, it's like a cold. You know, they don't have any symptoms. You know, thankfully, President Trump is one in that category where he got the disease, he got treated, and he was able to recover pretty quickly. That's great. But the problem is that, you know, a small percentage of the population in the vulnerable population areas of people with conditions or the elderly, or, you know, for whatever reason, you're susceptible to it. Those are the ones we're trying to protect. And so that's why what we're all doing as businesses about being a role model, you know, washing hands, doing the 3 W's are very important. And I talked a little bit about the Slow COVID NC app that's on your phone. A little more details around that. We launched that about six or so weeks ago. In fact, I'm happy to say that about 600,000 North Carolinians have downloaded this app so far. You know, we made an effort to try to go after the app to areas where we think that people would take advantage of it the most. So when we launched the app, we went after higher education first. So our colleges and universities and community colleges all really promoted this app within their communities. I think we all know that in August, when UNC and other universities started to have the kids come back to campus, you know, we saw outbreaks. And so, you know, this is a tool that they have now, so that as these higher education students come back in after the holidays, you know, this app is available. I mentioned that it's anonymous. It doesn't keep any information. Actually, how it works is that your phones have this technology called Bluetooth, and it's just a way for these devices to communicate with each other. And it acts like radio waves. And if you if you're back in the days, remember the AM radio, the further away from the station you were, it kind of got garbled and whatever. So we've been able to figure out to use signal strength to figure out the distance. So these phones now, these devices know that how far we can approximate how far they are. So any phone that's within 6 feet for more than 15 minutes cumulative, it just creates an anonymous token that just stays on your phone, and it keeps these tokens. And once someone tests positive for COVID and they have the app, we give them a unique code that they put in to their phone. And what it'll do is that it'll send a notice to every one of the phone that it came in contact with through a server to let them know that they've been exposed. And what we've been able to do is, on your phone, have put some instructions on what to do. Contact your public health department. Certainly get testing. Isolate yourself for a while. So, one of the things about the spread of the disease is that since we know that, you can not have symptoms, but still start to spread the disease. So it's very important that, as soon as you know that you've been exposed, that you take steps to minimize your exposure with other folks and get tested. And, we have a very robust contact tracing program going on in the state. This is a complement to that, so our contact tracers can get a hold of you and let you know what to do. So this is one of those tools. We're getting really good critical mass on it. The adoption is pretty high, but it's another thing that you can promote. That just, if you're in the grocery store and you don't know, but maybe you were standing in line with someone for 15 minutes and they tested positive, and then you can take protection or precautions yourself to get treatment, certainly, but then also avoid exposing others to the disease. So what more to do? Let's talk a little bit about the vaccine and having a head start. I've been part of the team that's been developing our vaccine response, and I know one of the things, and I think I've even heard that you may have some additional sessions on the vaccine, but one of the things about the vaccine is things that I hear is about the safety of the vaccine. It's, you hear the terms like warp speed and emergency declarations for authorization and things like that. But I can tell you what happened here, and this is actually one of the things that the federal government did a great job is that normally when a vaccine's developed, a drug company will have an idea, they'll develop a multi-phase process where they'll test the drug, usually 5,000 to 7,000 folks, and then once they think the vaccine is successful, then they'll go through government approval, and then they'll start to manufacture the vaccine. Well, one of the things that Warp Speed did, and the reason why we have the vaccine today, this week, is because the federal government at the time of the development of these vaccines says, you know what, drug companies, go ahead and start production. So while these drugs were going through the standard normal process for these different phases of authorization and approval, the vaccine was being made. So that's why, last week, the Pfizer vaccine, when it was announced that it was approved, we started shipping right away. We got shipments. In fact, North Carolina was the very first state to get a vaccine shipment. We got our first shipment on Monday morning at 7:20 in the morning. I think it was Wake Forest Baptist was the first hospital to get it. So this vaccine is as safe as any vaccine that's been developed. The other good news about the vaccine is that the newer technologies, the way it was developed, it used just a small snippet of the RNA, so it's not a live disease. When you're injected with it, you can't get the disease from it, but it does trigger, your body's immune system to build the antibodies. So another thing that we want to make sure is that we start to have the population of the vaccine available to the normal population to know that it's safe. It was developed in a normal process. It's just the manufacturing was just done ahead of time. And I think as business leaders, getting the vaccine yourself, encouraging your employees to get the vaccine, once it becomes available, once it's their turn. If you've seen on the media, we have, several phases of vaccine. We're obviously, vaccinating, healthcare workers who are treating COVID patients first, and certainly folks that are in, nursing homes and long-term care facilities and other congregate living, and then, people who are the most vulnerable. We'll go through the list. That's on our website too. We developed that list with, recommendations from the CDC and an independent council here in North Carolina. So when it's your turn, I encourage everyone to get a vaccine, and I encourage you to encourage your employees to get the vaccine as well. The other thing as part of that is that, there's been very, very minimal side effects. It may be just like getting a flu shot or things. And so, that's really the message I have for y'all today. I think we have some time for questions. And so I just really appreciate you take some time out of your busy day here, right before the holidays, but I'm honored to be here, and I'm really looking forward to, if there's additional questions that myself or Walker can answer for you. I'm here. So I think I'll turn it back over to the moderator, and we can go into questions.
Great. Thanks, Sam. My name is Hattie Gawande. I'm in the Office of Government Affairs here at the department. I will be moderating Q&A. So we have Sam here, and we also have Walker Wilson, who is our Assistant Secretary for Policy. So if y'all have questions about anything that Sam just presented on our guidance, anything like that, I'll ask those questions of Sam and Walker, and I'll have them answer them one by one. And Sam and Walker, I'll let you decide, which of you can answer what.
We'll sort it out.
So the first question is, we've heard that there are many strains of the virus. Is the vaccine equally effective against all of them and any new? We have a series of questions about the efficacy of the vaccine, actually. So I'll just read the other one too, which is, do we know yet how long the vaccine will last and will protect against COVID? Okay.
So I'm not a medical doctor, and so what I'll recite from you is the guidance that I know about, and if Walker wants to chime in, she can. But the vaccine, the two vaccines that are imminent, the Pfizer one has been approved already. That's the one that some of our hospital systems are starting to administer now. And then the other one, which likely get approval this weekend, is the Moderna vaccine. They're very similar. Both of them have shown a 95% effectiveness against the vaccine. And my understanding is the way it works is that it's going to really reduce the symptoms that you get from the vaccine, from the virus. You will get it. I've not heard that it's not effective of any particular strain. Maybe Walker knows more about than I. It's been effective against all of the COVID so far. And how long it's going to last? I mean that is one of the things that I mentioned. This process for trials is that we don't know yet how long it will be effective. It'll take the trials will continue, and they'll still continue to get the data, but there's not been a determination of that yet. The CDC and the FDA, when they authorized the vaccine, had specific additional guidance around that. I don't have that in front of me, but you can look that up. And I don't know if Walker, you have any more information you'd like to add than what I just said about the effectiveness of the vaccine.
Yeah, I think you covered it as far as neither of us being physicians. Sam, I think you did a great job. Also, I can put in the chat, or we can make as part of our follow-up email a link. We have a new landing page for the North Carolina vaccine as part of our COVID response. We have a series of Q&A that I think will be helpful, as well as a link to our vaccine plan, which was originally submitted on October 16th. I think Sam mentioned this in collaboration with the North Carolina Institute of Medicine, which convened a vaccine advisory group. There's a chart that talks about the prioritization in particular. I know we're getting a lot of questions about that really looks at those employees, whether they're in healthcare or long-term care staff and residents that are most at risk for contracting COVID and prioritizing those populations and just flagging. It's a little bit different than sort of what traditional essential workers are because it's based on your risk of exposure to COVID specifically. So some of the sort of critical infrastructure are not exactly the same people, but I think it's laid out pretty clear in the vaccine plan. So we will make sure you all have those links as follow-up.
Thanks, Walker. So we do have, we have a number of people, as Walker mentioned, who asked questions about where they are in line. I think Walker said it will direct people to our website to know exactly where you stand. Just know that right now, you know, we're in a phase where it's those healthcare workers who are taking care of COVID patients and people in our long-term care facilities right now. So wait to hear more. But on that, there is one question about when will there be widespread availability of the vaccine?
Yeah, I heard Secretary Cohen answer that specific question on her media briefing yesterday. And so the way the vaccines are distributed is that they're allocated from the federal government, and really it's on a weekly basis. We know what the distribution is like. Just today, we got next week's allocation numbers for the Pfizer vaccine. Once the Moderna is approved, we'll get that. There are other vaccines that are in the queue that could help for supply. And so, as Walker mentioned, we have a detailed list of who's in line, 1A, 1B, and 2, 3, 4, et cetera. So we know the queue. And then what really matters is how much vaccine are we going to get. And so, each week we know how much we're going to get the next week, and then based on that allocation, we fulfill that. So the expectation the real answer is we don't know exactly how much vaccine we're going to get when, but as far as our planning is concerned, we've looked out, and so we anticipate that by the first part of the calendar year that we'll start to get enough vaccine to start to move down the list. And by late spring, we expect that we should be, have enough vaccine to start to inoculate the whole population. And again, it'll take time to schedule all that and get implemented. So, we're looking at the springtime here for, to have enough vaccine so that, someone who's the least vulnerable list starts to get vaccine. And I don't know if Walker, if you have more detail than that, but that's kind of the latest that I've heard.
Yeah, and the other thing I'll flag, Sam, is that people who have 2 or more chronic conditions that make them at higher risk for severe illness from COVID kind of get bumped up outside of sort of their employee role. That's in the vaccine plan, and I think we link to a CDC page that talks about those chronic conditions. Yes. But sometimes the answer to the question about where am I in line is a little bit nuanced because they may not be in a certain prioritization in the framework based on their employee role, but because of their 2 or more chronic conditions that put them at higher risk for severe illness, it kind of bumps them up in the phases. So just flagging that. And the other thing I'll say is, please know that we are open to your feedback. There are some populations in the prioritization framework that is based on the employer determining how at risk their employees are, specifically healthcare, but a few other settings as well. So if there's more information that you need that would be helpful in how you communicate with your employees, please know that we want to continue to be good partners with you and would like that feedback on what would be most helpful.
I think another detail I think it's important to mention here is that at least the first 2 vaccines are two doses. There's an initial dose, and then either 21 or 28 days later, there's a secondary dose. And the thing that the federal government has done is that they are holding back that second dose. And so when you start to hear numbers about how much vaccine is available, it's really times 2. Is that if like our first allocation was it 85,800 doses? Well, there's 2 doses, so all 85,000 people will get both of those doses. So I know there's been some confusion around that. So it is 2 doses now. As other vaccines are approved, some of them are single dose. That may not be the case, and hopefully that's true for some of the newer vaccines coming out next year. But the current ones are 2 doses, and the number you hear, it's already been set aside your second dose.
Yeah, and on that note, there are also a lot of questions about when and where employers can inquire about access to vaccines to offer them to their employees. And what I'm hearing is, it's early yet. It sounds like we're going to be doing another one of these kind of convenings in January, and so we'll have more specific information. But Sam and Walker, let me know if you want to add anything onto that for employers who are looking to vaccinate their employees.
Yeah, so I would say that yes, we will be offering additional guidance on that. But one of the things the state has done is that we've developed our own system, our own technology database system, if you will, to keep track of this, so that we can monitor all of the vaccine that's coming into the state. It's being dispersed out through the state. You may have heard that one of the vaccines requires ultra cold storage, where all that manufacturers figured out how to give enough dry ice for that. So, that it's a logistical issue. We have to keep track of it. But, there will also be a portal that'll be opened up that where you can register to get the vaccine. It'll have that notification built in to let you know that you need to get your second dose. Plus, there's also a little card that'll go along with that. So, as I think Walker mentioned, the first doses are going to healthcare providers that are servicing the COVID patients. But as that opens up, we'll open up this technology to make it as easy as possible for employers and even individuals to get their vaccine, and a reminder to get their second dose if they get one that requires that.
So we have a bunch more vaccine questions, but I will defer to one question about sort of business operations and staying safe in the workplace. One individual asked, related to business operations in 2021, she mentioned the idea of a staggered schedule, and she asked how else might businesses fulfill employee expectations of health and safety? Should they be doing air purifiers, special cleaning, continued social distancing? Walker, I don't know if you want to speak a little bit to that.
Sure, I'm happy to. And I think the link to our business guidance is in the presentation, which you'll get following today's webinar. And I can put the link in the chat. We have a lot of business specific setting guidance on our webpage, which I think Sam touched on. And there's one specifically around sort of general businesses that don't have additional restrictions under an executive order. That I think the information is really helpful. We consulted both with our medical epidemiologists as well as our environmental health team. There are some cleaning foggers and things that unfortunately some people have purchased that are not recommended by CDC. But we get into the details about what cleaning products should be used. All of this comes from CDC originally, but we have North Carolina specific guidance. So I'll put that link in the chat. I do think whenever you can reduce density, increase air circulation, et cetera, and requiring masks indoors, anything you can do in your workplace to mitigate the risk of viral transmission is absolutely worth doing. And if there are any follow-up questions, I'm happy to take those offline.
Yeah, if I could just talk from a DHHS perspective. I mean, for the most part, we have taken a telework posture. So the majority of our employees are working from, but we do have some that are required to go to the office. So, we've gone through our offices and we've put hand sanitizer in places. At our reception areas, we have the screens. In our elevators, we've got the locations, make sure people stay 6 feet apart. So, that information is on the website of how to do that. But I think one of the things that comes up in that we've had a few cases that, what if a COVID person goes to one of the offices, what do you do? So we have specific guidelines on, amount of time to wait and or the cleaning procedures for that. I can tell you that, one of the things you need to be conscious of is not only just taking care of the physical location, but communication to your employees about that. I mean, employees need to know that, you know, if you've had someone with COVID in there, that you are taking the proper steps, that you're following the CDC guidelines. Let people know that, because the rumor mill can get out of control. So, you know, we have all that on your website, and I think, you know, inevitably someone may come into one of your spaces, and you know, handling that properly will go a long way to building confidence in your employee base, you know, that you've got this, that, you know, you care about their safety, and you're following the proper procedures.
So I know we're nearing time. I'm going to ask one more. I know that there are a lot more vaccine questions coming in, so just know that there will be more information coming out here. We'll try to do another one of these to just answer the vaccine questions, but I wanted to make sure I hit this one because I think it strikes at the heart of what Sam was talking about at the beginning of the presentation. So the person said, I heard that if North Carolina's numbers remain the same as now, 4,000 and up, we will not go back to any additional shutdowns. When will this change? So first, I want to point out that last week, almost every day that week, we had more than 5,000 numbers a day. And on Friday, we had 7,500. So it's gotten a lot worse than that just in the post-Thanksgiving bump. But Sam, do you want to speak to what we're afraid, you know, what will happen if our numbers continue to look the same?
Yeah. So Walker works a lot on this. Is what her job is, to develop the policy. But I can just tell you from the leadership perspective of DHHS and the governor's office is that, you know, and I think you've heard the governor make this appeal, is that, you know, we want to do everything. We want to make sure that our residents do everything that they can to, you know, follow these real simple 3 W's, so that, you know, we don't have to take any additional steps. Is that, you know, one of the things that we track every day is our hospital capacity. How many people in the hospital, you know, how many people have COVID like symptoms, early indicators, what our percent positive rate is for the COVID testing. And I can tell you, in fact, I'll give you a preview. When we announce that number today, if it's not out there by now, it's going to be one of the highest, if not the highest percent positive we have. That is one of the things that is really concerning to us, because that means that, you know, the virus is really starting to take hold. And once we see that, then we know that our hospital capacity is going to be stretched. So, you know, that's why I really emphasized in the beginning, now is the time to really follow these simple things. If we do that now, we hunker down, we can make it through the holidays, then the governor and the secretary won't be compelled to look at additional actions. And you know, that's really the bottom line here, is that no one wants to do that. But, you know, the governor has said that, you know, he will take additional steps if the numbers continue to increase. I don't know, Walker, if you want to add more to that, but.
You know. You covered it, Sam.
Yep, okay.
And on that note, in terms of like the action item there, we have created a set of materials that says we need to slow the spread to keep the economy open, and we'll be sharing those in the materials that NC EDA and EDP-NC share after this. So if you want to post that in your window, if you want to post that on your website, if you want to put it on social media, we would love for you to spread the word. And NC EDA, I'll turn it back over to you because I know we're at time, and thanks everyone for your questions.
Thanks, Sam, for all that great guidance. Our thanks also go out to Chris Chung and our partners at EDP-NC. We appreciate all the terrific questions from the audience. As a reminder, all webinar registrants will receive a link to the recording of today's presentation for your use. I'd like to offer one last shout out to our annual sponsors listed earlier. Support from these organizations and companies is critical to everything NCDA does. Hopefully, we can say goodbye to the pandemic in 2021 once and for all. In the meantime, I wish you a safe and memorable holiday season, and thanks again for being with us today.